What if I told you that most people are being told they're fine while their labs are quietly showing early signs of disease? Here's the problem. Standard lab ranges are designed to detect disease, not prevent it. So today I'm going to walk you through the top 5 labs that you should be asking for from your doctor that are not routinely ordered, but can completely change your health trajectory. These are the labs that I use every single day in my practice to catch things early before they become a diagnosis and we're preventing disease. This is where functional medicine is different. We're not waiting for things to break. We're looking for patterns. We're looking for dysfunction and early warning signs. Your body screams, it whispers before it screams, but it's letting you know that something is off. So let's get into it. Lab number 1, fasting insulin. It's one of my absolute favorites, and almost no one is checking it. Most doctors will check your glucose or your A1C, but those are late stage markers. Fasting insulin tells us what your body is doing behind the scenes. Optimal range is between 2 to 6. If your insulin is elevated, your body is already struggling with things like fat storage, inflammation, hormonal imbalance, future risk of diabetes, Alzheimer's, and even cancer. This is one of the biggest markers I look for cancer patterns. You can have normal glucose and still be insulin resistance. I see it every day, all day long. It's one of the earliest warning signs that we have. Lab number 2, I talked about this before, maybe last year, probably a lot last year. High sensitivity CRP, which is your C reactive protein. It is an inflammation marker, and inflammation is the root of almost every chronic disease we see. Optimal range under 1. Most conventional ranges say under 3 is fine. I strongly disagree. If this number is elevated, something is driving inflammation. It could be gut issues, poor diet, stress, autoimmune activity, hidden infections. This is one of the simplest but most powerful markers for long-term health risk. This is one marker that I look for with my RA. If it's elevated, I know that I got inflammation that I need to address. So if you feel like you have inflammation, this is definitely one marker, and I can guarantee you do. It's one marker I would ask for from your doctor. Lab number 3, super important, vitamin D. And I'm not talking about you are deficient. I'm talking about optimal levels for immune function, hormone balance, and cancer prevention. So many times, most labs say 30 is fine. It is not fine. Optimal ranges are 60 to 80. My menopause, perimenopause, postmenopausal women, I like to see well over 70. And that is a huge breast cancer prevention marker. And if you already have a cancer diagnosis, such as breast cancer, you need to be 80 and above on your vitamin D levels. Low vitamin D is linked to fatigue, depression, immune dysfunction, severe increased cancer risk. It's one of the easiest things to fix and one of the most overlooked markers. Lab number 4, homocysteine. It's a huge one and almost no one checks it. Homocysteine is tied to methylation, which impacts detoxification, brain health, cardiovascular risk. Optimal range is 6 to 8. If this is elevated, it can mean B vitamin deficiencies, increased stroke and heart disease risk, poor detox pathways, and it's especially important if someone is dealing with fatigue, brain fog, or cardiovascular concerns. Lab number 5, iron panel with ferritin, iron saturation, and your TIBC. Most people are told your iron is fine based on one marker. That's not enough. You're not even scratching the surface. You need the full picture. You need ferritin. You need serum iron. You need iron saturation. You need the TIBC. Because here's the truth. You can have low iron symptoms and high ferritin, especially in inflammation. Or you can have iron overload, which is rarely caught early. This panel tells us oxygen delivery, energy levels, inflammation status, even infection patterns. And if you want to go one step further with your doctor, test the waters, get a full thyroid panel, not just your TSH. I see it all the time. I had a friend send me labs yesterday. All they checked was the TSH. It blows my mind because you're not getting the full picture. You're not seeing if anything's being converted correctly. All you're seeing is the TSH. Also, another great marker that I like to look at is your fasting glucose insulin ratio. So here's what I want you to take away with from today. You have to advocate for your health. If you're being told everything looks normal, but you don't feel normal, there's more to the story. These labs will give us some answers. They allow us to be proactive instead of reactive. And that's how you prevent disease, not just manage it. Okay, a few questions that I had. Can I request these labs from my primary care doctor? Yes, you can, but some doctors may not be familiar with optimal ranges. You may need to advocate for yourself. So research these markers that I discussed today. Really know what you're talking about when you go in there. Remember, you're not going to have much time to get your point across. So know your labs. Two, will insurance cover these costs? Some will, some won't, because these MDs are so restricted about what they can and cannot draw from the insurance companies. A lot of them are not able to. Most of these are relatively inexpensive if you are paying out of pocket and incredibly valuable. How often should I check these labs? Typically every 4 to 6 months if you're actively working on your health. That's with anything. About every quarter, a very basic panel is great, but at least 4 to 6 months, you should have extensive labs done. A lot of things can change. Believe me, I've seen it. What if my labs are normal, but I still feel off? This is exactly why optimal ranges matter. Normal does not mean optimal. It does not mean healthy. Five, can I improve these naturally? Absolutely, you can. Nutrition, movement, sleep, and targeted supplementation can dramatically shift these markers. Which one of these is the most important if I had to choose one? If I had to pick one, fasting insulin, because it drives so many other issues. Should I fast before these labs? I always tell my patients to fast. Your doctor seems to forget to tell you that. Your nurse forgets to tell you that. But if you don't fast, it can really obstruct your blood results and also make sure that you're not working out before you go give blood because those can also throw your numbers off. I would aim for 8 to 12 hours of fasting to make sure that you are well within that window. What symptoms might show these are off? If you're experiencing fatigue, weight gain, brain fog, inflammation, poor sleep, hormone imbalance, time to get your labs checked. Number nine, do these labs help with weight loss resistance? Absolutely, 100%, especially insulin and inflammation markers. Last question. Can these labs help detect early disease? Yes, and that's exactly the point here today. We're catching dysfunction early. So listen, if you guys have any questions on these, if you missed it, if I'm talking too fast, because I did drink my coffee, feel free to email me, Cindy, Cindy, at drcindyross.com. Happy to give you those lab markers in your email so you can take it to your doctor. But remember, just research. You're your best advocate. Know what you're talking about when you go in there and really, really, really stand strong in your point of preventing any diseases that come on. We want to hit it first before there's a diagnosis, okay? I hope you guys have a great day. And as always, thanks for tuning in. I'll see you next time.